the very latest. But March, not just St. Patrick's Day, which is why I got some green on, it is also Colon Cancer Awareness Month. And we wanted to bring in a doctor now to talk about this. And he is from Lux Primary Practice. And it is Dr. Udon Alvarez. Is that right? Is it Udon? Adon.
No, it's Adan
Adon.
Alvarez.
Okay.
Yeah.
First of all, good morning, doctor. How are you doing?
Good, good. And yourself?
I'm doing well. Thank you very much. I'm amped about the SpaceX launch. So you have a very
Oh, yeah.
excited Nick Notario. So that's a good thing. And this is an important topic to talk about as well. And doctor, when it comes to colon cancer, what are some risk factors that people need to know about, and what can they do to reduce the risk?
So I wanted to say a little bit about colorectal cancer and why it's so important to screen for it. Colorectal cancer is the third most commonly diagnosed cancer in males and the second in females. And there's about 150,000 cases in the US, of which 100 are colon and 50,000 are rectal. And we also see a spike in the risk of developing colorectal cancer between the ages of 40 and 50, which is why screening guidelines have changed, to bringing the age down to start screening at 45, but, in certain populations, it goes down even lower than that. So coming back to your question, as far as risk factors. So risk factors can be divided into modifiable and non-modifiable risk factors. So those which we cannot modify are things like age, race, and actually we see that Black Americans, Native Americans, and Alaskan Americans tend to have a higher incidence of colorectal cancer that tends to appear at a younger age. Some of those other non-modifiable ones would be like inflammatory bowel disease, certain genetic diseases, family history, diabetes, and also being on certain medications. Some of the modifiable risk factors are things like obesity, diet, so eating a lot of red meats, processed meats, and then of course tobacco and alcohol. And then as far as what can we do to reduce our risk,
Right.
so studies have found that being physically active, having diets that are high in fruits, vegetables, fish, fiber, and even garlic that helps.
What are some symptoms? So I talked about what you can do and your risk factors, but what are some symptoms of colon cancer, and when should someone go see the doctor?
So, of course, symptoms for colon cancer are going to be very, GI or gastrointestinal based. So, the biggest one being changes in your bowel habits. So, if you're pretty regular and now all of a sudden you're suffering from constipation, diarrhea, that would be something to go get checked out, making sure that it's, nothing cancer related. Another big one would be rectal bleeding. Especially if it's bright red blood, that's something that we definitely need to get checked out. And there can be small amounts of blood in the stool that actually are imperceivable to the human eye, so those would have to be picked up on testing. Also rectal masses, and of course if you have anemia, that could indicate that you have a slow leak somewhere, so that's when we would test for blood in the stool and possibly colon cancer. Of course, there are some symptoms that, like weight loss and fatigue, that could be an indicator of any type of cancer in particular.
And I know that you talk about how important it is to get tested, but that still could be scary for people, just to do any kind of testing or to go to the doctor. So, exactly, what is a test like, and how do you, if you do have it in your body, how do you get diagnosed from that, and how do you get treated?
So testing comes in several different forms, right? Screening in particular can be done either with at-home, stool test where you take a stool sample and you can send it out or take it into the lab, and those stool tests measure are looking for blood in some cases, and in other tests they'll actually look for certain cancer markers. Those tend to be the most convenient, but those are the ones that need to be repeated the most often, some of them yearly. The other way of screening for colon cancer is by actually going and having scopes done, so like a colonoscopy or a sigmoidoscopy. And those do require, you going to see a specialist, getting medication beforehand to get your colon cleaned out, and then during the actual procedure, they put a camera in your intestines to have a look from the inside, and of course that's the gold standard because that test in particular is both therapeutic and diagnostic, meaning we can have a look in there and see if there's anything abnormal. But if anything abnormal is seen, then the doctor can right then and there take a sample of it and make a diagnosis, whether it is cancer or maybe it's just a polyp that's benign. So those are the two big ways of screening for and diagnosing. There are other less conventional methods that are not really approved, and those would be like a capsule that you swallow that actually takes photographs in your entire GI system. But of course, since it's only taking snapshots, if it's not facing the right direction or if it just passes wherever there's a polyp, I mean, it might not catch it. But those are reserved for certain patient populations who cannot have traditional testing and screenings done.
And coming off of that pill that takes pictures, which is kind of interesting, what are some of the other latest advancements in colon cancer research and treatment?
So usually, treatment is based on the diagnosis. So depending on what type of colon cancer and how, if it's just localized to the colon or if it's starting to spread past the muscle tissue or even past the colon and into surrounding areas or lymph nodes. So there they would do surgery to physically remove it, as well as chemotherapy or radiation therapy. To shrink the cancers down and try to get rid of any underlying cancer that might still be left behind. And then some of the latest advancements are actually using immunotherapy. So immunotherapy is when we actually use the body's own immune system to fight cancer cells. And then there's targeted therapy, and that's developing drugs that are very specific and target genes and proteins that are involved with cancer growth. And surgery is always getting better. So of course, there's always new techniques to try to minimize the incisions and the amount of disruption that the surgery causes. Trying to just overall get more cancer out and making it more comfortable for patients. And they're always developing blood tests also. So there are actually certain blood tests that we do looking for tumor markers that if present with that cancer, can be used to down the line to make sure that patients don't get recurrences or to just monitor progress of treatment.
We've got Dr. Alvarez from Lux Primary Practice here joining us now on the 8 a.m. hour of the stream. And I know that he's got his website here so you can learn more information about his practice. But also, Doctor, we pulled up some information from the U.S. Cancer Society, and it had some stats that showed exactly how many people get tested for this. And Texas, if let's go ahead and pull that map up. Texas doesn't do fairly well, especially compared to the Northeast. Why do you think that is? It shows that only 59% here, facts and figures from the American Cancer Society. These are people that are getting cancer screenings, colon cancer screenings, 45 years and older, compared to Massachusetts, where I'm a native from, is at 70%. Doctor, why do you think there's such a huge gap between like the Northeast, you can see the darker blue, versus Texas is that lighter blue?
Well, personally, I feel that one of the big factors is access to medical care. So because there are such rural areas in Texas, I feel that is a big barrier to actually, being seen by a doctor and then starting preventative care. Of course, there are a lot of other factors such as, just general mindset. But I feel that Texas having such a large rural community probably plays a big role in that.
Dr. Alvarez, we're talking about colon cancer awareness because it is Colon Cancer Awareness Month. Anything else you want to let our viewers know before we let you go?
Well, the biggest thing is really just establishing a good relationship with your primary care doctor so that you feel comfortable bringing up any issues as they arise. and of course going to get your yearly yearly preventative visits with your primary care doctor, because during those visits are when we really go in depth as far as risk factors, so anything that might be genetic or family related, and then we can tailor screenings based on those types of things. So colon cancer in particular, if you have a family history, especially with first degree relatives that are that developed cancer early on in life, then those screening guidelines, instead of starting at 45, for example, may be cut back down to 35. But those are things that you need to discuss with your doctor in particular. So, having a close relationship with your primary care doctor is always key.
All right, Dr. Alvarez, thank you so much for joining us this morning. I really appreciate it.
Of course. Thank you so much.
All right, now let's go ahead. We only have a few minutes left, and so let's